Hi everyone, I'm Dr. Justin Lin of Rehab and Revive Physical Therapy. We have a treat for you today. We have a special guest. He's a YouTube vlogger, video logger. He found me over my YouTube channel and over Yelp and decided to contact me. His name is MelodicMic, or Michael.
What's going on, Dr. Lin?
Hey, how's it going, Michael?
Doing well, doing well. Just want to say it's MelodicMic, and you can check me out at on YouTube. Also, I had some shoulder pains going on, and I started to go on YouTube to see what I can do to revive myself. Came across Dr. Lin, and then looked at his Yelp, and he had so many different people commenting on it. Gave him a shout, sent him an email, and I'm here today.
All right, well, let's get started. I figure we start with an exam, and that's what we're going to do right now. He's got some pain in his left shoulder, and he wants it checked out so he can continue further working out and improving his quality of life. What I like to do with a lot of my patients is to test neuromuscular ability to make sure the muscle is contracting the way it should. So since Mike right here is having some left pain, I do want to see how his shoulder sets. And what I mean here for shoulder setting, go ahead and relax, Mike, is that the shoulder joint comes together, or it approximates together to give a stable force couple. Okay. So I want to see, Mike, if it happens for you. So you're just going to meet my resistance, okay, and I'm going to gradually just put more pressure on you and see if I can break you. Okay. So as I'm feeling a few things. I'm feeling as I push down that this side's a little bit unstable. We're exaggerating this right now on video, but I can see that he just can't control as I push down. On this side, you can see how everything sort of suctions in, and that gives him a stronger base. And I can go on this for a while, for a few minutes, and he's still going to be strong enough to maintain this force through his body, through all the way down to his legs. On the left side, he just can't do that. So I can push again as hard as I can, and he's just going to lose it, and he just doesn't have the support of his whole body.
Yeah, it burns too.
And so that's going to create some breakdown over time if he's going to do the overhead lifts or the chest presses. The next thing I'm going to have you look is just certain ranges. I like to check different body parts because they all goes together. The neck is often an area I want to take a look at or examine, and also the mid back. So the neck, I want to see how his neck is moving with rotation. Go ahead and turn to the left, please. Alright, so he gets what we would say on our scale about 60%. Let's see on the other side.
60%?
Yeah,
wow.
60% only. And on his other side, he's able to get a little further, and I think you can see that all on video. That's about 70% to 70 to 75%. The next thing also is to take a look at side bend. So I'm going to have you take your ear and also try to bring it down to the shoulder, and that's about 50% actually on this side. Only 50%, Mike. I'm sorry to let you down there, or your body's letting you down. And this side, you can see, just got a lot more. That's about 70%. So this is something we do want to revisit at the end of the day, end of the session, to make sure we had a full comprehensive session. So you're going to see this again, and you're going to see a lot more improvement. I guarantee that. The next thing we want to examine is his mid-back. This has a big contribution to the shoulder blade, and you're just going to rest. I'm going to just see how these different motions, you're going to help me a little bit as you're going to go ahead and look up, and I'm just going to feel and see if there's any bend or no bend at all. So, and this one feels okay. As I get a little higher, I start feeling limitation. Do you feel that?
Yeah.
Kind of hurts, probably a little tender, and then I go a little higher. So I kind of have a focus area. And this is the mid back. I would say it's right at this level. It's really keeping him from being able to extend or allow his shoulder blade to come back towards this direction. Alright, Mike, so I have a model here so you can understand what's going on with your shoulder. A couple different things here. Your mid-back isn't moving. You ideally want your mid-back spine has got to push in. And that's not happening for you at a certain section. I would say it's your thoracic levels 4 and 5. The other ones move just fine. In terms of your shoulder blade, what needs to happen is, as this slides back so you can lift your arm overhead, it pushes these things forward. So if it's blocked, you're going to have to compensate out further at your shoulder where it hurts.
Okay.
Okay, so, and I'm going to check out a couple other things when you're lying down, but I have a feeling that you're going to have some tenderness across your collarbone and out towards this upper part of your shoulder, which is your acromioclavicular joint. And those things will also there's an interplay between those things as well if your mid-spine's not moving. All right, so we have Mike laying down right now. I do want to see, other than some structural things, just some more of this biomechanical thing. They have to move in the right order. The sequencing, the timing is really important in cases of the shoulder or anything dynamic like the hips, the knees, the neck, the lower back.
It got cold, so I put my shirt on.
All right, yeah. So I'm gonna take a look. Like I said, I want to take a look at his collarbone, but I want to see it in action. And so, as I'm feeling right here, he's feeling this little pinch out here, but I'm feeling this. There's no movement here. I kind of took a quick exam earlier, and I see that this is moving very well. So that's got that nice little rotation. That way it feels a lot easier, right, Mike?
Yeah.
On that side. But this one it's getting blocked. So this is something I want to attend to as well. A couple other things that may get affected over a long time, if this has been a long case, is his nerves. So this is the most important thing to nip in the butt. And I'm going to take Mike and do a quick check on some of his nerves. These are the same nerves that cause carpal tunnel. Okay? And you can see, where do you feel that, Mike?
Ooh, right down to the fingertips.
They're down the fingertips. Yeah, those are the same nerves that really cause carpal tunnel. And if you don't nip that in the butt, one shoulder pain may lead to carpal tunnel, and you don't even know it later on, years down the line. So as a preventative step, we can really also work on some of that nerve tension. The other thing I want to examine over here is Mike's neck. I want to see if it's too stiff, there's some areas stiff, or if it moves too much in some cases. So as I'm going through and doing some quick assessment on his neck, I see that it moves so much. Mike, do you like try to crack your neck a lot?
Yeah, when I feel like it's stiff, I always try to
You like try to snap it?
yeah.
Okay, so we want to try to avoid that a lot, Mike. It's really important because, as I detected earlier and as you felt, this nerve has there's some tension here. And if you crack it enough, you're going to snap that. You might even end up with some kind of nerve palsy or even self-induced creation of carpal tunnel.
So it's a bad thing?
It's a super bad thing.
Oh.
I'm going to have to give you some strengthening exercises at the end today, so that way you can stabilize this. This area is just too mobile. I'm not gonna try to adjust this area or move it around. I just want him to stabilize that so he has a better base for his shoulder to move. So this is really important. So we're going to discuss that in a little bit.
Yeah.
All right, so right now I want to focus on his nerves, but in order to do that, since he's got an unstable neck, I need him to stabilize it. I got to teach him that exercise I was going to teach him later on. Mike, what I want you to do, if you look at me, I'm going to stand right over you. What I want you to do is do a chin tuck, okay? It's bringing your chin kind of towards your throat a little bit. You're going to work on little muscles back here underneath. You should feel them right alongside your spine. They're tiny muscles called multifidi muscles or multifidus. And they do a really important job to prevent gravity from compressing a lot of your spine. Gravity's going down against you at a rate of about 200 pounds per half hour. So if you're at a desk, and I assume you're working at a desk for some time during the day, you can incur between 3,000 to 4,000 pounds of pressure every day. So these muscles get tired, and you have to strengthen them and work on their endurance. So I'm going to have you basically stabilize this while I work on your nerves in your shoulder to kind of relax that tension here. So go ahead right here. Good. And you're going to see that a lot of my work as a manual therapist is to work around the area that's hurt. So I'm not really even going to touch your shoulder today because it's probably a little bit inflamed, and I felt that earlier. It's a little bit hot. And to just work at that is just going to irritate it more. I need to work on scaffolding around your body. Okay? So I want you to keep that stable. That's going to keep everything locked in for me. And I'm going to work just like I did that test. Just kind of block that and get that nerve to come out and glide. We want, ideally, what we want is the nerve to glide between the joint spaces and the muscle spaces. So I'm going to press right here up in his neck. A lot of people feel that knot sometimes. Are you feeling that?
I feel a knot, yeah.
Yeah, so what I'm going to try to do, Mike, I'm going to have you push into my hand with your hand, good, and just relax a little bit. This is just some assisted nerve stretching, what I'm trying to do. And it's going to get better. Push. Okay, good. And relax. Good. You okay?
Yeah, I don't feel the
All right.
the nerves anymore.
Yeah, it's a little bit less, right?
Yeah.
Go ahead and push. And this is a technique also called functional mobilization. I'm one of about 250 manual therapists that actually practice this in the world.
Wow.
Push. So hold that, and then I'm just gonna do a quick little. And there it goes. Nice. More freedom, right? Is there less pain?
Yeah, there's definitely not a pinch,
Yeah,
or it doesn't feel as
It just moved. This probably feels less too, right? Great. So go ahead and I'm gonna have you relax here. You're gonna just do a little bit more stability here because I'm gonna start pressing on this part of your shoulder blade. So I'm gonna take pressure here, and I want to create actually by working on the nerve, create some more mobility here. Believe it or not. Do you feel that? Feel a difference, right?
It's not stiff.
It's not stiff,
It was
right?
stiff earlier.
Yeah, so actually by just working on the nerve, we changed the dynamic motion of his collarbone, and it doesn't seem to be quite as stiff or probably as painful. Right? Is that right, Mike?
No.
All right, so this is called the sternoclavicular joint, SC joint. A lot of people at about our age or his age start degeneration. Actually starts around mid-20s. So if I am pressing, I'm trying to get this a little bit. Yep, and he's keeping that stable for me, which is great. Good job, Mike. Then we're gonna go a little further. Like I said, I'm not gonna touch his shoulder directly, but that AC joint, that acromioclavicular joint, is actually the junction between his collarbone and his shoulder blade. So I want to see more motion out of that actually. So this might be a little tender, some of these techniques.
Yes, it is.
We're trying to get this thing to mobilize, and that's kind of one of my strategies, to mobilize the things that are stuck, then to stabilize. So we got to create some stability later. What I'm going to have you do here is a cool technique to mobilize here. I'm going to have you put your palm down. I'm going to have you actually press down into my hand, and that's just, and it hurts a little bit, but actually as it frees up, it's going to be, and it's starting to free up right now, it should be less painful. Is it less painful?
Yeah.
Just pretty quick, right?
Yeah.
Your body responds really great, and that's actually your neuromuscular component. Your neuromuscular is really strong, so re-educating you is going to be great, and it's going to be easy, and you're going to be on your way between 1 and 2 sessions. So you're going to respond real well to this, and I can feel that because everything just releases so quickly with every response to whatever therapeutic method I'm going for. Great.
Wow.
So actually, let's check that out again. And now it moves.
Oh, yeah.
Yeah, all right. Right?
Dang.
Yeah, it's quick.
I thought that was going to take a long time for it
Yeah,
to recover.
exactly. And that was really quick. But what we have to do is, I'm going to give you a self-exercise to really re-educate that. That's the really important thing. So now we created mobility. And so if you don't have the strength or the stability, then you're going to lose it quickly. That's why a lot of people, sometimes when they go to the chiropractor and they don't get that proper neuromuscular re-education, they fall right out of alignment. So this is actually the most important thing that I stress in my style of therapy. So just like you were doing right here, actually all you really need to do to re-educate is actually stick your own hand. So this is just some self-exercise, a little bit different. You don't need weights or you don't need machines, but you just gently do it that way, and then you also do it in reverse.
So pull.
Yep, just gently, I would say about, between 20 to 30% of your own, effort. You don't have to do that hard, and it shouldn't hurt. None of these exercises should hurt. And so you're just slowly, and you can hold right there. So go ahead and hold, and then what you're trying to do is create an isometric contraction, or a contraction where your joints aren't moving. And that's going to create a neural input back into your brain to recognize this new range, the new safer range. This is going to create a couple things. It's going to give you longer lasting benefits and more pain relief. So go ahead and go a little bit higher again. Go. Is this causing any pain at all?
No.
Great. Yeah, so this is some self-exercise you can do as a warm-up prior to working out again.
Okay.
Great.
Nice.
Great. Yeah, get you back into the gym. Okay, great. All right.
Oh,
It
yeah.
feels
It feels so
loose.
loose.
Remember, go ahead and try to move that yourself. And I want to feel for control. So there's still a little bit of lack of control here, but we're going to get right to that, and that's the shoulder blade education that I want to get at. Okay?
There's no pinch anymore.
There's no pinch, but still, it's not the root. We still haven't got to the mid back. So that's what we're gonna go to next, okay?
No body double, it's still me.
All right, so we have Mike on his side, but this is the most important thing, is to get this neuromuscular sequence, this motor planning in his body to do the right thing at the right time. So we're gonna just see how his mechanics are right now, even though I worked on some of the mechanical things like his joints and his nerves. It doesn't mean that his body's fully recognized what's going on. So Mike, I actually just want you to lift your arm up this way, and you can see it just doesn't seem as stable. Does it feel stable to you?
That's tight.
Feels tight again? Yeah, so a different angle sometimes yields different feelings for the patient or anyone with pain. So you can see actually that this muscle's really overactive. The correct mechanics is actually to have this kind of drop down and come over, and that's going to give him less pressure. So you can see the shoulder blade is then going to make some room for his arm to actually come up. So this goes up and this comes down. Very important. Okay, so, all right, Mike, let's go ahead and try that right now. So I'm going to actually have you help me along with this, up and down, up and down. Okay, can you take this motion over?
Yeah.
All right, real good. Any pain? Should be no pain.
No pain.
No pain. Great. All right. So now I'm going to apply some resistance. This is where we tap into that neuromuscular. Hold that for me, Mike. So, and then I'm going to have you lower it slowly, controlled. And I feel a little bit of ratcheting in his muscles. That shows lack of control in certain areas. Pull it up. Now we're going to try to smooth that out. So hold that right there. Hold that. And it's going to go through some shakiness. Shakiness is actually your central nervous system trying to pick up what's going on. And you're a little shaky, right, Mike?
Yeah.
Yeah, so let it go slowly, and you're going to pull me back up again. Good. There you go. It's really good. And pull me back up. This is one of my key techniques here for getting people better faster. This little neuromuscular exercise here, technique. Hold that, and then let it go slowly. Good. Pull it up. Good. We're trying to deactivate muscles and activate the right muscles. Push down right here. Very important muscle right here. Let's go ahead and push. Try to use that shoulder blade. There it is. Let's hold that. Hold that right there, and then you're going to let it go slowly. Control, 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 push. Good. Control, control, and push. Good. Control, and push. There you go, Mike. That's really good. And push. Good. Now you're going to pull up. We're going to do some reversals. Push down. We're going to re-educate. Pull up. Actually, this is also going to re-educate his mid-spine. Let it go slowly. Let your head relax on the pillow. Let it go. Good. And push. I'm making him sweat here, and I'm also having to exert some effort. But this is really important to actually nip it right here. If we don't take care of this part, all that mechanical things we did earlier are just going to come back. All the stiffness in his collarbone, the nerve pain, instability in his neck. The reason his neck gets so stiff and he feels his stiffness is that he doesn't have the right strength. Even though he's so, strong and appears very massive, he just doesn't have that strength right where the muscles are supposed to happen so he can function correctly. Push. All right, pull it up. Good. He's doing good. Push down and hold. Hold that for me. Good. Actually, it's really a lot more solid. I can feel that right now. So actually, let's take a look again now, Mike, and describe to the viewers how everything's feeling. But go ahead and lift that up and down. It should feel light as a feather.
It feels really light. It feels really loose. It's not as tight. I don't have that pinch that I felt earlier.
Yeah, you can see this mechanics happening perfectly. This rotation is spinning around this axis. This muscle's loose, perfect, and there's some action going down here. Now we'd have to do probably another session for him to get this fully moving correctly, but this is great. This is great. His body's responding really well. So one last thing before Mike goes and I show him some exercises is to actually affect some of that mid-range, mid-back stuff that he was feeling earlier. So right here, you feel that knot?
Yeah.
Probably doesn't feel very good.
No.
So actually I'm going to run through this neuromuscular re-education, and he's going to retrain actually the muscles to keep this joint, this mid-back joint, in the right place. All I'm doing is just putting pressure here, and he's working it out himself. This is some functional mobilization. Also, to give a shout out to my mentor Greg Johnson and Vicky Johnson for teaching me some of these techniques. I can't take full credit all my own. Alright, push down, good. Pull up, good, perfect. It's starting to work itself out, right?
Yeah.
Pull up, yeah, less. Push down,
I don't
good.
feel it not
Pull
any
up,
longer.
good. Push down, good. There it is. I can feel that. Push down, great. Now his body's responding really good. Push, yep, pull up, hold. Try to keep your back a little stable, good, and then down. Perfect, great. And it actually came out pretty quickly, so within seconds. All right, so we're at the conclusion, and I want to retest what I did and see if I actually made some changes in Mike. This is really important. So let's start with that genie position again. Mike, you already in that position? Great. And you let the audience know, see if it feels any different. All right, so I'm going to do that. Oh, yeah.
Definitely more loose, more flexible.
Yeah. And I can get more further. Yeah. Great.
It's not tight. Yeah, I just feel like loose.
Just feel great.
Yeah, I feel loose. I'm not tight. Shoulders feel good. Back mobility is strong again.
Yeah. All right. Let's take a look at his neck rotation since you guys saw that earlier. Okay. So he had some limitations on his rotation and his side bend. So Mike, let's go ahead and this is. Yeah, we didn't even do this beforehand, but this is on the moment right now. How much did you gain? About 20 more degrees?
Yeah.
Yeah, try that again.
I think I only could see where the wall was there.
But now you can
I can look behind.
You can look, and then even probably the other side is a little bit better too. I didn't even touch that side at all.
Wow.
I didn't even touch his shoulder for today's treatment. And as soon as it calms down, probably the next treatment, we can work in there a little bit more, see if there's any scar tissue. But you can see, let's go ahead and side bend here. Let's see. Oh yeah, you can almost go a little further. That's a lot better. Yeah, is that okay?
Yeah.
Is that okay? All right, final test. Let's actually see some shoulder setting and see if that, actually, before we do that, let's just move your arm up, see if that just makes a difference. That looks beautiful. Yeah. I can see that his shoulder blade, his collarbone is moving great. And like I said, probably another session of some re-education here. It's going to do him some wonders. Great, let's actually have you stand up, Mike. Great. Okay, we're going to check out that shoulder setting. I don't know if you guys remember earlier, but I was able to move this a lot, and I haven't tested them yet, so let's take a look at my work. Go ahead, and you're just gonna resist me, and slowly I'm gonna build up the strength, and wow, I feel that. He's getting that shoulder setting, that suction action at his shoulder. And you can see that, I can almost put my whole weight down and it's not gonna break. And that's really gonna be huge for whatever he does, bicep curls, overhead lift, anything you do in life, just even pushing a vacuum or a shopping cart. So that's going to help Mike a great deal. So Mike, that was a great session.
Yeah, thank you so much.
Yeah, thank you for coming in.
Really appreciate it. I feel good. I mean, we're here for a good 10-15 minutes, and all the adjustments that were made and all the re-education so far feels good. So I look forward to continue learning what I need to do.
Great. I'm Dr. Justin Lin of Rehab and Revive Physical Therapy. This is Melodic Mike, and I think you can check us both out. And thank you very much. Have a great day.
What's going on, everybody? Melodic Mike. Just finished my session with Dr. Lin. I feel great. It's crazy. I found him on Yelp, saw his YouTube videos, and then I just went ahead and contacted him. And now, without even touching my shoulder, he just educated me on different type of movements and strength. And I feel great. I feel as though I can go back to the gym. I feel loose. I can start doing my movements and doing my powerlifting again. But I really appreciate Dr. Lin spending some time with me, educating myself, as you guys saw in the video. I guess this is my testimonial for everybody that's looking to, in the Orange County area, everybody looking to, learn more about your body and how to rehab it and revive it. Visit Dr. Lin. Make sure you check out his Yelp, check out his YouTube stuff. And yeah, and then check my YouTube stuff out, MelodicMic, MELODICMI. Until next time, thank you, Dr. Lin.